right, so today we're going to talk about the benefits of one particular ingredient that I chose to use in our product HEMO FLOW from Leviathan Nutrition, which is dihydroquercetin, also known as taxifolin. So throughout this video, I'm going to be using taxifolin or dihydroquercetin. Just know that each of these terms are used interchangeably and is referring to the same ingredient. So we're going to talk about dihydroquercetin and how it relates to hematocrit as well as blood viscosity. So blood viscosity is highly dependent on hematocrit as well as other factors, but out of all the other factors, hematocrit is probably the most important one. So high blood viscosity is the main issue that high hematocrit will bring when it comes to complications that you can have from having high hematocrit levels over time. So usually the higher blood viscosity is, the higher hematocrit is, and once your hematocrit goes up, your blood viscosity will also go up. But there are some cases where there can be an exception where you can bring down hematocrit and you still have high blood viscosity due to other factors. Now, an example of where cases like this occur are in chronic mountain sickness, where you have people who live in very high elevations for long periods of time. So their hematocrit will be high as well as their blood viscosity, but then you control their hematocrit to get down to a decent level, let's say 40%, and they still are dealing with the problem of high blood viscosity. So it's important to realize that just because you normalize hematocrit does not necessarily mean that you will be normalizing blood viscosity. So blood viscosity is not only dependent on hematocrit, but it also depends on other factors. So it's important to note that blood viscosity is not only dependent on hematocrit, but it also depends on other factors like circulation, the amount of fibrinogen in your blood and other plasma proteins, as well as red blood cell deformability. Now I'm going to get a little bit into each of those. So let's start with blood flow. So if you have poor blood flow, if you have slow blood flow, that gives the red blood cells more time to interact with each other due to their polarity, the charges on the molecules and all this, and possibly clump together. Now, the slower that your blood is flowing, there's a higher likelihood that these blood cells can then clump together and possibly lead to clotting, or just in general lead to increased blood viscosity. Now, this clumping of blood cells and higher blood viscosity also applies when you're talking about fibrinogen. Fibrinogen is a plasma protein that is mainly responsible for these red blood cells to stick together and form clots. Now, the last one is RBC deformability. Basically, when you have red blood cells, you want them to be able to be kind of malleable, so they can take different shapes and kind of squeeze through smaller capillaries and vessels in your system, that they can pass through that unobstructed. Now, when you have red blood cells that are more rigid and they're not going to take a shape easier, they can clog up smaller blood cells that they have trouble going through, and slow blood flow and all that. So the gist of this is that if we control blood viscosity by controlling multiple of these factors and not just hematocrit, we have a more effective way to address the issues that arise from high blood viscosity. And kind of a side note, this video is not on nattokinase, but it is in HEMO FLOW. So nattokinase has been shown to degrade fibrinogen, and that's how it assists against blood clots and can possibly reduce blood viscosity. So that's another one of these methods for controlling blood viscosity that we're going to get into, rather than only focusing on hematocrit. So let's get into the circulation and blood flow issue. So when you have poor circulation or slower blood flow, this is going to allow for more molecular interactions between those blood cells, which can cause red blood cells to kind of aggregate, clump together, and potentially lead to blood clots, or at least blood viscosity, so a higher blood viscosity. So this is why products that help to increase blood flow, like nitric oxide products, may also be beneficial whenever it comes to having better blood viscosity to help with that blood flow and prevent this whole clotting process from occurring. And an example of this, of course, is the vasodrive ingredient that we use in HEMO FLOW. It's kind of going to be more responsible for these blood flow benefits to help with blood viscosity. And of course, here we just have a graph where we relate hematocrit to blood viscosity. So you can see going from 40% hematocrit to 60%, we see an exponential increase in blood viscosity. So of course, this shows that blood viscosity and hematocrit do have a linear relationship, although that is not the only factor that affects blood viscosity. So rather than focusing on reducing hematocrit, we want to really focus on reducing blood viscosity as a whole, because the main issue with high hematocrit is blood viscosity. You can see from this graph, increasing hematocrit from 40 to 50%, which is a 50% increase in hematocrit, can increase the blood viscosity over 100 by 100% from 4 to 8. So increased viscosity will increase the resistance to blood flow, increases the work of your heart, impairs the passage of fluid through all of your organs. So this has a compounding effect. Some patients with anemia who have low hematocrit also have reduced blood viscosity. So again, we're seeing some of that linear relationship that applies both ways towards both high hematocrit and viscosity and on the low end. And here's a big take home for this ingredient, dihydroquercetin. So the combination of dihydroquercetin and ascorbic acid in either a ratio of 1:1 or 1:2 by whatever study you look at, reliably can reduce blood viscosity by 15 to 17%, which is pretty substantial when you're just dealing with one ingredient. And there are multiple clinical studies showing these effects of dihydroquercetin. So we're going to get more into the just how interesting this ingredient is. All right, so getting more specific now towards taxifolin or dihydroquercetin and the benefits from this ingredient. So it prevents oxidative cell death in red blood cells. It also improves the elasticity or the deformability of blood cells, making it easier for them to penetrate even delicate blood vessels, improving microcirculation at the capillary level. And of course, all this can lower the risk of stroke and heart complications. Looking at a study that used 40 milligrams of taxifolin per day resulted in the following. It resulted in a significant reduction over 3 months in systolic and diastolic blood pressure and a decrease in the frequency of cardiac contractions. Also resulted in a reduction in stagnant processes in microcirculation flow and improved microcirculation in general. Supplementation with taxifolin also partly reduced rheological damage and hemodynamic problems in the microvessels. So after 6 weeks of treatment, a normalization of endothelial function is seen for those who are suffering from high blood viscosity issues. And taxifolin also inhibits platelet aggregation induced by ADP and thrombin release, just to get more technical. So another take-home point here for taxifolin, a lot of these studies show that taxifolin may provide protection against red blood cell aggregation, coagulation, and thrombogenesis, and that they can elevate red blood cell deformability. Again, the importance for these red blood cells to be able to travel through small capillaries while they transport oxygen or carbon dioxide, which can be another beneficial effect for subjects suffering from hypertension, or this word that I can't say or I get flagged. And there's actually a lot of very interesting things regarding this and blood viscosity. So how this ingredient will also help if you're someone who's had this issue and you're dealing with some high blood viscosity issues, highly recommended, but again, can't really discuss that, or what happens. So moving along now, let's get into the chemical structure of taxifolin. Here we have the chemical name. I wanted to include the chemical name so you can see where all the hydroxy groups are on this molecule. One takeaway in general, when we're dealing with a flavonoid structure like this, is the loss of the 3-OH, 3'OH, and 5'OH groups when you have a backbone structure like this one can significantly reduce the ACE inhibitory activity of various flavonoids. So let's look at this structure here. Here's the 5' where we do not have a 5' OH group on this molecule, but we do have the 3' OH and we do have the 3 OH. So we do have a good bit of ACE inhibitory activity from this molecule, which again can be beneficial for something like blood pressure. Now, compared to normal quercetin, this has 2 more OH groups, as you can tell by the name dihydroquercetin. So we have a little bit better water solubility with this molecule, but it's important to note if we had that 5' OH, it would probably become too water soluble, and then we'll kind of run into issues with bioavailability when it comes to humans actually ingesting this molecule and getting it to perform the benefits that it's supposed to. So we have kind of a balancing act there. And just another thing to note that adding bioperine can help with the bioavailability of absorbing this molecule by protecting those OH groups from liver metabolism, which we do have in HEMO FLOW. And again here, focusing on the topic that adding vitamin C with taxifolin amplifies the effects of the taxifolin. The combination of dihydroquercetin and ascorbic acid, which is vitamin C, reliably reduced blood viscosity in those studies by 15 to 17%, compared to just dihydroquercetin alone, which is around 12% reduction in viscosity. So that's very interesting and tells you that something else is going on that has some sort of synergistic effect involving vitamin C with this molecule. Now in Russia, a complex of taxifolin and vitamin C is actually a popular treatment for many diseases. It's a prescription medication, I believe, where oxidative stress is the underlying mechanism. And again, they have several studies of their own that show this combination reducing blood viscosity very reliably. And just getting more into some details from studies that I've seen, 2 clinical studies conducted on 52 patients to evaluate the effects of 21 days worth of administration of taxifolin combined with vitamin C on patients with cerebral circulation problems. The supplementation resulted in decreased blood viscosity, decreased clot forming tendencies, improved memory, attention, mental performance, reduced vertigo, normalized sleep patterns, relief from headaches, and less fatigue, which these are also all common side effects that you see from high hematocrit level. So once you take taxifolin, it takes about 2 hours after administration starts showing up in blood levels until it's active and doing its thing. Half-life wise, it peaks at around 8 hours. That's when it's most potent after you take it. And it takes about 13 hours after that first dose, to normalize and come back to normal levels. So with this information, probably a best idea for you to take 1 dose in the morning, 1 dose at night. That way you have a constant supply, constant levels of taxifolin in the blood. All right, and now let's get more specific into the hematocrit reducing abilities of dihydroquercetin. Now, dihydroquercetin has the ability to reduce iron by being a competent iron chelator. You can see with this diagram how exactly it chelates iron. It can complex with 3 different iron atoms per 1 taxifolin molecule. So it can reduce hematocrit by antioxidant, anti-inflammatory, and iron chelating effects. And one thing that's important to note about this, when you talk about chelating effects with iron, a lot of people will think of IP6. Now, the difference between this molecule and IP6 is that this molecule does not have those anti-nutritional properties like IP6, but it still functions as a iron chelator. So we can compare and say dihydroquercetin is superior versus IP6 when it comes to reducing hematocrit and blood viscosity by the following. Dihydroquercetin chelates iron, and that of course can reduce hematocrit and red blood cell count. On top of its iron chelating abilities, dihydroquercetin compared to IP6 has more definitive clinical studies showing its benefits on blood viscosity and red blood cell deformability effects that IP6 does not have. IP6 does have a little bit of evidence on improving deformability effects of red blood cells compared to the red blood cells of sickle cell patients, which is a very specific illness and doesn't really tell us what this ingredient might do for the deformability effects of a person who doesn't have sickle cell. So dihydroquercetin, on the other hand, does have studies showing its deformability effects on people without these kind of diseases. Of course, dihydroquercetin doesn't have any known anti-nutrient properties. So you don't have to worry about spacing it out from your meals, spacing it out whenever you take other vitamins, like you would with something like IP6. So compared to IP6, dihydroquercetin also chelates iron, so it can also reduce hematocrit, but it also can reduce blood viscosity by other factors, such as improving the deformability effects of red blood cells, as well as increasing blood flow and decreasing blood pressure. So that wraps up this video on the benefits of dihydroquercetin and how exactly we use it in HEMO FLOW to give us these blood viscosity benefits, and why we choose to use it versus a more typical approach of something like IP6, just because of all those other additional benefits that come with dihydroquercetin. That's going to help it more synergistically bring those improvements towards not only hematocrit, but blood viscosity as well.